All right, joining me on the hotline as we do each and every week is Dr. James Ohliger from the Center for Orthopedics with an injury update. I want to talk today a little bit about J.J. McCarthy, who obviously was a very high draft pick out of the University of Michigan. Did not play as a rookie, had an injury in preseason. He has season-ending knee surgery on a torn right meniscus. Let's start there, because we hear meniscus talked about all the time when we're talking about knees and knee injuries. What exactly does that mean, and how do you fix it?
The meniscus is a piece of tissue in your knee. You have two of them, the medial and lateral meniscus. They're shock absorbers that help prevent arthritis down the road. Very commonly torn in athletes or even older individuals. The problem with the meniscus is that it does not have great blood supply. So there's really two fixes to it surgically. Number one is you remove it, or you remove the tear, or number two is you repair them. Depending on patient activity level, age, future career, dictates what we do from a surgery standpoint.
We're talking about young athletes, guys who are, just out of college sometimes, like McCarthy, who's probably 22, 23 years old. So as players get older, they retire and they're in their 30s and 40s like me. Does it lead to, future problems down the line, knee replacements, pain, things like that?
Absolutely. Meniscus is something that really helps absorb a lot of the shock that we see on an everyday basis. And so an analogy I give people is, imagine driving your car without shocks. That car sees a lot more stress and force through it. Just very similar when someone tears their meniscus in their knees. That knee and the cartilage in there will see much more force and pressure throughout the course of someone's life. So these football players or even athletes that have these tears do see issues down the road when they're 40, 50, or 60, much higher risk of arthritis.
Doc, you're the best. We appreciate the time, as always. If any of you guys out there have questions or concerns, you can give my team at the Center for Orthopedics a call at 440-329-2800.